Call this public hearing of the Alabama Department of Environmental Management to order. Good afternoon. I'm Todd Carter with the Alabama Department of Environmental Management, and I'm the designated hearing officer for this hearing. I'd like to welcome each of you to the hearing today. The subject of this hearing is proposed revisions to ADEM Administrative Code Division 335-17. Notice of the date, time, place, purpose of this hearing was published in the Birmingham News, Huntsville Times, Mobile Press Register, and the Montgomery Advertiser on August the 21st, 2022. Copies of the certifications of these publications are submitted for the hearing record as Exhibit C1 through C4. On August the 19th, 2022, and August the 26th, 2022, the department also caused the same notice to be sent to 2,738 individuals and organizations requesting advance notice of rulemaking. A listing of the individuals and organizations notified will be entered into the hearing record as Exhibit C5. A copy of the proposed rules was filed with the Administrative Procedures Division of the Legislative Services Agency, and a copy was furnished to the Joint Committee on Administrative Regulation Review on August the 19th of 2022. A copy of the notice was also published in the Alabama Administrative Monthly, Volume 40, Issue 11, on August the 31st, 2022. These facts are attested to by Othni Latham, Director of the Legislative Services Agency, by affidavit, which is submitted for the hearing record as Exhibit C6. Copies of the proposed rules have been available for inspection by the public at ADEM field offices in Birmingham, Mobile, Decatur, and ADEM offices in Montgomery. The proposed regulation changes have also been available on the ADEM internet site at adem.alabama.gov. A copy of the proposed rules is submitted for the hearing record as Exhibit B1. A copy of the summary of reasons supporting the adoption of rules is submitted for the hearing record as Exhibit B2. The department has given public notice of these rulemaking proceedings. A hearing is being conducted to provide the public an opportunity to present data, views, questions, and arguments on the proposed rules. It is open to the public, and anyone wishing to present oral testimony or written testimony may do so. Persons who have not previously advised the hearing officer of their intent to give oral testimony should complete a registration card and present it to the representative at the registration table. All verbal and written comments received today and during the public notice period will become part of the hearing record. The information in the record will be used in evaluating the proposed rules. Lengthy statements containing considerable technical and other significant data should be submitted for the record in writing. Summaries of each of such statements may be presented orally. How all testimony and written statements should be as factual as possible and should address the subject of this hearing. This hearing is not intended as a question and answer session, and persons giving testimony will not be subject to questioning by the public. They may, however, be questioned by the hearing officer or any other representative of the Department of Environmental Management to clarify points and to develop a better understanding of the information being presented. We will now proceed to the principal purpose of today's hearing, the receipt of public comments. I would ask that each person making a statement step up to the podium, state your name, and any interest or organization that you may represent. This hearing is being recorded by a court reporter, and a transcript will be included in the public record. The order of appearances of persons giving oral testimony will be as follows. First, a representative of the Department of Environmental Management, then any public officials, then members of the public in the order they filed registration cards to give oral testimony. So I will now call on Cletus Stallworth, Chief of the Environmental Services Branch of the Land Division.
Good afternoon. My name is Cletus Stallworth, and I am Chief of the Environmental Services Branch of the Land Division of the Alabama Department of Environmental Management. I'm going to provide a brief summary of the reasons supporting the proposed revisions to the ADEM Administrative Code Division 17 regulations. Under the provisions of the Alabama Environmental Management Act, Chapter 22-22A, Code of Alabama, 1975 as amended, the Department of Environmental Management was given the authority to adopt rules, regulations, and standards in order to carry out the provision and intent of Chapter 22-22A. The Administrative Procedures Act, Section 41-22-4, requires each agency to adopt rules of practice setting forth the nature and requirements of all formal and informal procedures available. Revisions to the ADEM Administrative Code Division 335-17 are being proposed to clarify and improve the organization of regulatory requirements for registration, permits, treatment measures, transportation, and storage of medical waste. In addition, there are revisions to enhance public participation, amend regulatory citation, and make grammatical clarifications. The purpose of today's hearing is to provide an opportunity to receive public comments regarding the revisions as noted. The department welcomes your input to this process and will consider all technical comments prior to making a final decision concerning the revision of these regulations. The department will also provide a response to each comment and to those requesting specific notice of our decision. Thank you.
Okay. Now I'll call on public officials followed by members of the public in the order in which they filed registration cards to give oral testimony. I'd ask that each person making a statement step to the podium, state your name, and any interest or organization that you represent. And from the looks of the card, I don't think we have any public officials here today, but just to make sure, I wanted to ask, do we have any public officials present that wish to make a statement or give comment? Okay. Now I'm going to request that everyone limit your comments to 5 minutes, since I've asked for lengthy statements to be submitted in writing. But if anyone feels that they would like to make additional comments over that time, I will appropriate more time after everyone in attendance has a chance to speak. Okay, so our first request to speak, Stallion Sasser.
I was hoping to be second. I am an elected official. So anyway, thank you so much. I am Stallion Sasser. I am representing Region 8 Nursing Home Association here in Alabama. I am on the Perry County Healthcare Task Force. I've been actually on the Healthcare Authority of Crenshaw County for rural hospitals, and I'm County Commissioner in Crenshaw County. And I actually own South Alabama Waste Services, which is a transporter in the state of Alabama, and I only transport in the state of Alabama. So with all that, I'm going to go through a lot, so you may have to follow me. So appreciate y'all letting me be here today. Members of the committee, I appreciate the opportunity to address you this afternoon regarding the issue in its current form will potentially disrupt healthcare delivery system in Alabama and certainly impact all the rural providers. However, I do feel if we collectively bring together stakeholders, we can work together to achieve most of what I think was the original intent of this effort. As you are well aware, businesses in rural Alabama are struggling in their abilities to attract and retain staff, as well as meet the necessary financial thresholds to remain a vital entity. Healthcare is no different, and even minor, unexpected changes could cripple or close some providers in rural communities. In brief, because I know I don't have much time, if you have any questions after this, you could feel free to ask me afterwards. I'm very passionate about what I do every day. I take care of the elderly, and on my medical waste side, I think we really take care of the medical waste side in the state of Alabama very well. I'll get to that further in my process. But, this will impact healthcare, not just rural, but all over our state. The healthcare industry is total. I'm not talking just nursing homes. I'm gonna go to dentist offices, veterinarian clinics, but especially in our rural communities. On the transport side, this will impact terribly. I pick up and transport medical waste on all 4 corners of the great state of Alabama, including rural hospitals, rural clinics, rural doctors, dentist offices, rural nursing homes, eject. Alabama Department of Environmental Management, we're supposed to be helping the environment going green, right? If I have to go and, because we have 200 pounds more in a facility in Roanoke, Alabama, or Camden, Alabama, and I gotta go there once a week instead of once a month, I'm spending a lot of emissions at that point in time. A lot of gas, drivers, and you know, there's a shortage of drivers right now. You see it on TV all the time. And explain that on the nursing home doctor's office side. There's a container. It's got a bag in it, or it's a box. All right, say it's in a nursing home setting. There's a red container in that room. After that day, could have been flu, could have been C. diff, could be COVID. Okay, isolation. That all the stuff, gloves, a lot of PPE, masks, everything out of that room goes in that bag. End of the day, they take it. Most of the time in the nursing facility, they take it out to a storage building. It is not refrigerated, haven't been refrigerated. I've been in business since 1987. We've never had any refrigeration for as stored. And going to that, I don't understand when we can store 50 pounds and don't have to have it refrigerated, and you store 200 pounds more, you have to have it refrigerated. That is it's the same difference. This box is not going to grow legs and do anything. It's very contained. But anyway, then it goes in a box in our, it's a storage shed per se in a lot of facilities, and it goes in that box. So it's already lined with a bag, so you put another bag in the box. When that red bag, that's the outer layer, gets full, then they seal the box up, put it to the corner. Okay, well, just say it's a regular week, they may not have but 2 people in isolation. But now in South Alabama, we're having the flu hit very hard. So me being a transporter, they call me and say, hey, we got a flu outbreak because we got 10 patients on isolation now. Well, they're going to do over 200 pounds in a week, and they go on a monthly pickup. They got the storage for it. So I'm not having to cost them more money for emergency pickups or anything. So they may actually have, I'm going to say even 1,000 pounds of medical waste, but they got the storage for it. It's just not refrigerated. Same way that 50 pounds would not be refrigerated if it was there for a month. So I'll go on monthly pickups on some people. Some people are 6 weeks, some is 8 weeks. It's very cost efficient too on my clients. I think we did really good, and I think that we need a big pat on the back on all transporters, big and small. We had a big pandemic called COVID. I don't know how many times y'all got called about medical waste providers, but it wasn't that many that I know of. I know that some were, but at times we were dealing with staffing issues and things like that and training people. But I think that the nursing homes and the healthcare industry, this great state, did a great job during COVID in containing our medical waste and get it treated in the proper way. If these rules go in place, people are going to start taking shortcuts, and they're not going to be putting everything in there if they got to stay to the 200 pounds, because they will go out of business. So when you do that we're doing everything the right way, and we start regulating, they're going to have to cut corners. That's just the nature of the beast to stay in business. I hope that does not happen. On the nursing home side, I'm telling you that we are hurting as an industry. We really are. We take care of people that are sick, that's built this great state, this country, fought in wars for us and everything else. And I'd hate to see, because it would be, as a transporter, if I had to go somewhere once a week, and I'll mention Camden, Alabama again, if I had to go there once a week and pick up their boxes, that'd be detrimental to them, because their price would probably, because I got to pay my driver, fuel, and you know how fuel is today, their cost will go up $4,000. Times 4 at least. That's be detrimental to them, because we are struggling in rural health care. Same thing as the hospital in Camden. If I had to go pick them up once a week, sometimes, these rural hospitals, I know in Crenshaw County, they had 2 patients last week. So if they had 2 patients, but they didn't have but 2 boxes, but I still got to go pick them up every week instead of monthly, we've been doing a good job doing it anyway. Again, I'm going to say, I don't understand refrigeration. I'd like to understand that thought from y'all at some point in time. But we're taking in the transporter, again, we need to have more time than 72 hours once we pick it up to take it. There's no destruction facilities that I know of south of Birmingham. The only 2 that I know that's in this state is in Huntsville and a place a little above Tuscaloosa. So as me, being from South Alabama, my waste goes out of state to get treated, and so that takes a long time. So I would like to be able to go to Huntsville, Alabama, Roanoke, fill my truck up, it's staying contained in my truck the whole time until that truck gets full, and then take it to the treatment plant. It's not being moved as much. I could get a storage facility, but then I'm moving boxes, then moving them back in until I get a full truckload. If we keep the boxes intact, that helps out for leakage and things like that. That would be beneficial
I'm
too.
sorry to interrupt you. We're over the 5 minutes, but if you got, are you wrapping it up?
Yeah, I'm wrapping it up. I'll wrap it up real quick, but I'm very passionate about what I do and how this will affect rural Alabama. I really am, and how everything actually works. I know I'm on both sides of it. I can see how bigger companies can make this work in Huntsville and pick up every week if they're just doing the Huntsville runs. But I'm going to Huntsville, I'm going to all 4 corners. It can't work for small companies, and that's what keeps bigger companies, it keeps our prices down. Competition is good, but if some of this happens, some of your rural people will get out of the transport business. I'll close real quick. I appreciate your time again. But I want to say this one time. We did a great job during COVID. We did a great job during COVID. I believe that we had more. I was going to places and we was working 16 hours days with my drivers, and we didn't have an overflow. It just, we did the right thing. So I think we're ready if something like that happens again. I hope that you will see my concerns here as real, and we'll invite all stakeholders to get together and see what can be accomplished without potentially closing some rural providers and creating unnecessary financial burdens to the state or healthcare facilities. The availability of quality healthcare, including doctors, dentists, rural hospitals, and nursing homes, is critical for individuals in roles like mine as a county commissioner to be able to attract industries to our rural communities. Thank you, and I look forward to working with this group.
Thank you, Mr. Chancellor.
Yes, sir.
If there's some other thoughts, comments, think about, we'll have some extra time.
I think I covered pretty much all of it, but there's a lot in it, but thank you so much.
Oh, no problem. Thank you. All right, next I've got Stephen McCormick.
Gentlemen. Thank you very much. My name's Stephen McCormick. I'm the General Counsel of the Alabama Hospital Association. And we'll try to save some time if there is questions at the end. And I know Mr. Sasser went over his very well. A couple points to make. We sent this out as a regulatory alert to our members. We have over 100 hospital members within the Alabama Hospital Association. And I think the biggest concern is there's a lot of unknowns in this proposal, and chief among them is, went through the APA 1 and 2, and some of the answers to the questions, I guess I was just unsure of. Maybe I don't understand, and maybe I need some more information. I'm not an environmental lawyer, I can promise you that, okay? So we had to do a deep dive on this very quickly. But I don't know what changed pre these rules to post these rules, and what the health, safety, and welfare concerns if these rules aren't passed. What that correlation, because the answer to those APA 1 questions was yes, there would be some kind of effect. It wasn't stated in that rule. So, and the second, I think, is the biggest issue, is that there was no economic analysis done. There was no economic impact if these rules go into effect. And I think I just respectfully have to challenge that. I think if you go through these rules, and especially in a hospital perspective. And like I said, I sent out an alert to as many hospitals as I could get back in this amount of time, because this is a pretty delicate issue. You know, we're trying to treat patients as quickly as possible. Just like the previous presenter said, we just went through COVID for 3 years, and we're still dealing with issues. Now we've got pretty tough flu outbreaks. So there's medical waste being presented. And a lot of my hospitals, even rural, I was surprised, in some months have more than 220 pounds of medical waste. Okay, so taking out that deletion of the integral storage facility is going to make us potentially buy permits for every one of these hospitals. If we do all 100 plus hospitals in Alabama, that's a $250,000 increase on hospital health care, just in permit fees. Now, I'm not saying every one of them, but I'm just giving you a ballpark. If everyone had, it doesn't say if you go over 220 pounds one month, you have to buy the permit, or do you get a reprieve, or if you normally have 150 pounds, but we had a busy month during a particular season. So just saying that's an economic impact right now in healthcare. And if you look at our most recent cost reports under hospitals, 82% of hospitals in Alabama are operating in the red. 82%. Okay? And now we're talking about, if we have to pick up before every 7 days, that could mean a 2 times increase, could mean a 3 times increase, could mean a 4 times increase for some facilities, for some of our hospitals. So I believe, and what I looked at is, I don't know if there's any way around a hospital not getting a fee increase by these administrative rules. 1, the permit fee. 2, you got higher transportation fees. Because now instead of picking up once a month, once every 2 weeks, you're coming in once every week. And 3rd, all right, if we now have to do everything that we keep over 7 days in a refrigerated capacity under 45 degrees. I actually came from a commercial refrigeration background. So I called a contractor who works all over the Southeast, and I said, okay, let me give you a scenario. If I need a walk-in cooler that can store medical waste that's away from any other food products, anything, dedicated cooler, within a hospital, let's take a particular hospital, let's say, and let's do it. Well, the cooler is not the issue. It's all the equipment that we've got to put on the roof. It's the contractors we have to have, the amount of copper that we have to take to go through 3, 4, 5 stories. You're looking at cost at the very low end of $50,000 or $60,000 to have a refrigeration system like this, because we just don't have situations where we can just say, oh, here's our medical waste storage facility that we can now keep under 45 degrees. So again, I think there's 3 different ways that the cost increased, and respectfully so, I just don't think that was taken into account when we did these rules. Because if there is a situation that there's an economic impact, there should be an analysis. And that analysis should go on with the APA, with the filings. And I didn't see one. So maybe I missed it, maybe there isn't one, and there's one that you'll have available. I was also doing the research in this, talked to Ms. Roper, and I said, where was the stakeholder engagement? She said, oh, there was some information sent out, and she was very nice and kind and got me the information that was sent out. And we looked at it, and my association's name was somewhere on there. We didn't see that. I don't know what email it happened to go to, but I think there are some points if there's needed where there's more public interest input, or there's some of the things that training. If we need to train more for medical waste, I'm all for those things, and we can do those things properly. But I think we have to have a little bit more stakeholder engagement in the rules, because I don't think they understand quite how effective this is going to be on cost. And we're not doing well right now in an industry on cost. Everything is going up. Inflation's everywhere, but we're having a really hard time through this. And so to increase these costs on everybody, like I said, a few $1,000 on a permit fee may be the cheapest way out. But if it's $50,000, $60,000 for refrigeration, or 4 times the amount for our transporters to come in and pick up that medical waste, it's just going to be a very difficult issue. And I heard from several of my hospitals, and they had different, I can comply with this. I don't know that I can comply with that. My costs are going to go up 2 or 3 times. So we tried to get as much information as possible. But I think if you look at this, and we're having to do a lot of changes, it's going to impede patient care. And right now, we're trying to do the best patient care we can possibly do. To have capital expenditures and capital improvement projects is only going to take away from that, right? And so, again, back to my original point is, what's changed? What was wrong, or what's the problem that we were doing 6 months ago to now? Why do we need these rules? Just maybe a little more explanation on that. So, again, Stephen McCormick, Alabama Hospital Association. I'll be glad to answer any questions if you have any. Try to, and I would like to supplement the record, if this is the appropriate time, and hand deliver a public comment letter.
Sure.
Is that okay?
Absolutely. Thank you. Thank you.
Any questions or concerns? Thank y'all so much for your time.
Thank you. Appreciate it. Next up, Lindsay Mothershed.
Good afternoon. My name is Lindsay Mothershed, and I'm president of Square E Company, an environmental consulting company. I appreciate this opportunity to comment on the proposed changes to the medical waste regulations. I have my comments and additional comments on Excel spreadsheet I'm going to leave with you. To me, some of my comments, I think we need to know a little bit of the history of medical waste. I want to just briefly run through that, and it'll help make my points that I'm going to make. How and when did Alabama get into regulating medical waste? In the late 1980s, scenes on TV showed large quantities of medical waste washing up on the beaches around New York. Shortly thereafter, EPA was mandated by Congress to develop regulations relating to the management of medical waste. A 2-year tracking program in 4 New England states and Puerto Rico went into effect. Soon thereafter, Alabama's Attorney General formed a task force to study the management of medical waste and develop an action plan. It was decided that ADEM should develop regulations. In 1990, when the medical waste regulations was being drafted, the Department of Public Health deemed the authority to regulate medical waste was a hazardous waste law. They referred to the definition of hazardous waste, which included a phrase, has an infectious characteristic. However, ADEM decided to regulate medical waste as a solid waste instead of a hazardous waste. After adoption of these regulations, all healthcare providers had to register as a generator and properly manage their waste. Large generators and commercial companies transporting, storing, or treating more than 220 pounds of medical waste by non-incineration methods had to apply for permits. Applicants for a commercial treatment facility were required to obtain host government approval without the requirement being listed in the regulations. Host government approval was actually adopted in 1989 before these regulations were adopted. The main purpose of this law was to inform the public that municipal waste from out-of-state corporations may be landfilled in their neighborhood. When the 2-year tracking program ended in 1991, EPA concluded that the disease-causing potential of medical waste is greatest at the point of generation and naturally tapers off after this point. Thus, risk to the general public of disease caused by exposure to medical waste is much lower than risk for healthcare workers. EPA never adopted regulations addressing medical waste and left this to the states. Also in 1991, OSHA adopted a bloodborne pathogen standard to protect employees that may be exposed to potentially infectious waste. A few years later, USDOT adopted regulations for the transportation of regulated medical waste. In 2008, an act was adopted that defined medical waste as a solid waste. Should this be the point in history when medical waste should have been regulated as a solid waste? In 2012, ADEM revised the regulations, which are still in effect today. Generators are still required to provide training to their employees, even though OSHA has regulations addressing worker safety. They are also required to label waste containers for off-site shipment. which don't completely match US DOT regulations. Therefore, generators are required to label the containers to meet both ADEM and US DOT requirements. In these proposed regulations, ADEM is continuing the requirement to refrigerate the waste, but now has proposed refrigeration to be extended to all generators, even small offices, if the waste is stored longer than 7 days. Small offices will need to schedule pickups every 7 days or construct a secured storage area with refrigeration. A lot of these generators will not generate a full container of medical waste in a month. And the previous speaker just spoke on all of that and how it greatly increases the cost. A review of the medical waste regulations for the 4 contiguous states and the federal agencies listed above reveals no refrigeration requirements. Where is the science that justifies these extreme and costly measures? The contiguous states only require commercial transporters and treatment facilities to either register or apply for a permit at a fraction of the requirements that ADEM requires. Due to requiring host government approval to obtain a commercial treatment permit, the number of commercial treatment facilities are limited, and the first speaker spoke of that. There's none in the south end of the state. Therefore, most waste being shipped off-site is being transported out of state. However, there's been 2 exceptions regarding the requirement to obtain host government approval. In 2011, ADEM issued Alabama's first and only storage permit without the applicant obtaining this approval. The only commercial treatment permit issued since 2011 was in 2016, and again, this was issued without host government approval. Currently, I'm assisting Environmental Biological Services, a medical waste transporter, to help obtain commercial permits for storage and treatment. They were informed that they would have to obtain host government approval before their applications could be reviewed. Why did ADEM stop requiring host government approvals in 2011 and 2016, but now once again requiring this without any regulations for this? In early 2020, Americans became aware of a virus which became known as COVID, infecting a significant number of people all over the world. This virus was described as very contagious, which led to lockdowns, isolations, and social distancing. No matter what steps the federal government and state health departments took, the virus spread like wildfire. If the purpose of these regulations is to minimize exposure of a contagious disease to humans, why was people that were infected with COVID allowed to stay home, shop, and go to restaurants with only a face mask? Alabama finally removed the mask mandate, but the health department continues to report a significant number of positive tests. Did anyone inform people isolating at home or going out in public to take extra precautions with their COVID waste? These proposed regulations are more restrictive than the current version and extremely more restrictive than our neighboring states. Once again, where are the studies that support this, and where is the documentation that large volumes of medical waste have been mismanaged? Also, why is managing highly contagious waste at home not addressed? I appreciate, again, you allow me to speak, and I include my comments for you. Thank you.
Thank you. Thanks, sir.
Thank you.
All right, is there anyone who has not had a chance to complete a card who wishes to speak at this time? Okay, we'll let the record reflect that there's no responses. Okay, the final hearing record will include a transcript of this hearing, all written submissions and exhibits, and a response by the department to each relevant comment received by the hearing officer before 5 p.m. Thursday, October 13th, 2022. At the ADEM offices in Montgomery. After consideration of all oral and written comments, ADEM will make a determination regarding possible revisions to the proposed rules and prepare a response to all relevant comments received. When a final decision has been made, ADEM will forward the final draft of the proposed rules as may be revised, the hearing record, and if conflicting views are submitted, a concise statement of the principal reasons for and against adoption of the proposed rules and the reasons for overruling any considerations urged against their adoption and that'll be submitted to the Environmental Management Commission for its consideration and possible adoption. Once complete, this record will be available for public inspection in the office of the Department of Environmental Management here in Montgomery. Thank you for your attendance and participation today. This hearing is adjourned.